So the ongoing MANIFEST studies are really important, and as we see increasing data coming from the very complicated now 4-arm MANIFEST-1 study, and we can see really exciting data with regard to spleen and symptoms, but also biological endpoints. We saw declustering of megakaryocytes at European Hematology Association, and I'm expecting to see some data hopefully soon with regard to arm 4, which is ET. But what's ongoing is the MANIFEST-2 study, which is a randomized study for JAK inhibitor naive patients based on arm 3 of MANIFEST-1. And I think we're all really, really excited to see this study come to fruition. So it's really important to think about this study if you've got a newly diagnosed patient. And remember, don't put them on ruxolitinib and then think about a study. Think about the study first, because they won't be eligible for this study, or indeed the Transform-1 study, which is this kind of paired study doing the same thing for navitoclax. I think we can expect some really exciting results from this, as well as in line, hopefully, with arm 3 of MANIFEST-1. So watch this space.